Welcome to our webcast for UCD patients and families living with UCD in a COVID-19 world, presented in partnership with the National Urea Cycle Disorders Foundation and the Urea Cycle Disorders Consortium, the UCDC. The UCDC is part of the National Institutes of Health Rare Diseases Clinical Research Network. The consortium is an international collaborative of 16 international UCD centers of excellence for clinical research, working in partnership with NUCDF and the Eunice Kennedy Shriver NIH Institute for Child Health and Human Development to improve the lives of people with UCD. I'm Cynthia Lamons, Executive Director of NUCDF and a co-principal investigator of the UCDC. We're grateful to have as panelists today Dr. Andrea Grotman and Dr. Sandesh Nagamani, both co-principal investigators of the UCDC. Dr. Grotman is Chief of the Division of Neurogenetics and Developmental Pediatrics at Children's National Medical Center in Washington, D.C., and Dr. Nagamani is Director of Clinical Research in the Department of Molecular and Human Genetics at Baylor College of Medicine in Houston, Texas. Before we get started, I'd like to thank UCD patients and families from the U.S., Puerto Rico, Canada, Latin America, Europe, and as far away as Australia for submitting questions for the webcast. I'd like to introduce Dr. Nagamani first. He'll start us off with an explanation of COVID-19. Dr. Nagamani?
Thank you, Cindy, very much for arranging this webinar, and I'm very glad to be a part of it. What I'm going to do in the next 3 or 4 slides is give a very brief overview of what COVID-19 is before we delve into the specific questions of COVID-19 and urea cycle disorders. So what is COVID-19? So COVID is an acronym for coronavirus disease, and the 19 comes from 2019. It is a respiratory illness that is caused by a new form of coronavirus. COVID-19 has been reported from all 6 continents excepting Antarctica and from numerous countries. It's a highly contagious respiratory disease and can spread from person to person. So one common question is, how does this spread? COVID-19 spreads by what is called droplet infection. This means when an infected person either coughs or sneezes, the secretions that come out of their respiratory tract can either land on surfaces, or if you are in close proximity with affected individuals, they can land on your skin or over your mouth and the eyes. And then the virus can have entry into the body. Now, even if it is not in close contact, but they are deposited onto surfaces such as plastic or metal, the virus particles can remain active for a variable amount of time, but typically it is said that after 2 to 3 days, the virus spread would decrease from these deposited surfaces. Now, there are anecdotal reports which also says that the virus can remain suspended in air. So this is called aerosol spread. And so if you are in close contact with a person and they were to sneeze or cough, the viral particles may remain in the air and they themselves can cause infection. Though this mode, called the aerosol mode, is likely to be less of a problem in spreading as much as the droplet infections. So how can one prevent the spread of the disease? Is by taking precautions. The precautions to take are documented in multiple websites. I would recommend that you please go to the CDC website and see what precautions you can take to decrease the risk of spread. Now, a common question also that is asked is, what are the symptoms of this COVID-19 infection? Now, this disease presents with a highly variable symptomatology, and there are individuals who present with no symptoms, and there are individuals who have severe symptoms that can even lead to death. What is known is that symptoms typically develop between 2 days and 2 weeks after exposure, either to an infected surface or to the respiratory secretions from an infected individual. And most people who develop symptoms develop the common symptoms, which are fever, cough, fatigue, anorexia, which is loss of hunger and not wanting to eat, myalgia, which is sort of pain in the muscles and having quote flu-like symptoms, and shortness of breath, which is difficulty in breathing. Now, other than these common symptoms, COVID-19 can also cause a serious illness in some individuals, which has been estimated to be somewhere between 10 and 20%. So, how does COVID-19 impact individuals with urea cycle disorders? Now, individuals with UCDs can also develop symptoms and complications of COVID-19, just like individuals who do not have UCDs in the general population. At the current time, it's not known whether individuals with UCDs or other inborn errors of metabolism are at increased risk for developing the infection or contracting the infection. However, the individuals with UCDs who've either undergone a liver transplant, and these individuals are typically taking medicines to suppress their immune system so that their liver can function well, they may be at increased risk for infection. Also, more importantly, any acute viral infection like a COVID-19 in individuals with UCDs can trigger hyperammonemic crisis, wherein patients can develop elevated ammonias and the symptoms that come with elevated ammonias that the community is quite well aware of. So before we go into the specific questions, I just wanted to give an overview, and now I'll hand it over back to Ms. Lamont to moderate the questions and the answers to those. Cindy?
Thank you, Dr. Nagamani. Our first question is, are UCD kids and adults at higher risk for COVID-19? Are they considered to be in the high-risk disease categories that the CDC talks about? Dr. Grotman, can you take this question?
Sure. So currently there are no data that suggests that children and adults with UCDs are at increased risk for being infected with COVID-19 or have a higher risk of developing more severe disease if they were to be infected. The CDC actually considers a number of high-risk profiles, and those include patients who have underlying medical conditions, particularly those that are not well controlled. That would include individuals with liver disease, chronic lung disease, or moderate to severe asthma, serious heart conditions, and people who are immunocompromised. Many conditions can cause a person to be immunocompromised, including having had a bone marrow or organ transplantation, cancer treatment, smoking, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids or other immune weakening medications. Other factors, particularly in adults, include severe obesity with a body mass index of 40 or higher, diabetes, and chronic kidney disease, which requires dialysis.
Thank you, Dr. Grotman. Dr. Nagamani, can you take this next question? What could be the impact of COVID-19 on a UCD patient? Would the impact be different on a UCD patient than on a healthy adult?
Sure. So individuals with UCDs can develop signs and symptoms of COVID-19 similar to those without UCDs. So in the general population, that is the population without UCDs, the impact of the disease is as follows. A small proportion of individuals may show no symptoms. Majority of the patients, which are estimated to be around 80%, have what is called mild disease. This means that they do not have serious respiratory symptoms and they don't need hospitalizations. However, around a fourth or fifth of individuals develop more severe COVID-19 complications that may require hospitalization, oxygen, and other therapies to make sure that they do well. Now, in individuals with UCDs, in addition to the symptoms resulting from COVID-19, which I just outlined, the infection, the fever associated with the infection, and the nausea and vomiting associated with the infection may also lead to metabolic decompensation, which is increasing the blood ammonia levels. Now, the increased level of blood ammonia, it can cause nausea, it can cause vomiting, it can cause decreased appetite, it can cause altered mental status, confusion, and seizures. So it would be reasonable to think that COVID-19 can have a more negative impact on individuals with UCDs than in the general population.
Great. Thank you, Dr. Nagamani. Dr. Grootman, would you please take this next question? How do you expect UCD patients of various ages will cope with COVID-19?
Sure. We will be addressing these in more detail in the following slides.
Thank you. Our next question, Dr. Nagamani, can you take this? What are the signs to look out for if a UCD patient gets COVID-19? Should any additional measures be taken, or should there be any changes to the sick day regimen?
Sure, thank you. So the common symptoms of COVID-19 that I have outlined in the previous slides as well include fever, fatigue, dry cough, loss of hunger and appetite, muscle aches and pain, what are called myalgia, flu-like symptoms, and shortness of breath. The cough is typically dry, but in 30% of patients with COVID-19, sputum or mucus production is seen. Other less common symptoms also include headache, sore throat, runny nose, and some patients can also have gastrointestinal symptoms such as nausea and diarrhea. More recently, some neurological symptoms such as confusion, paralysis, and stroke have also been reported. Now, the signs that you have to look for can be categorized into three categories. So firstly, the symptoms that suggest a more severe respiratory illness have to be monitored. So while at home, monitor how the infected individual is breathing. Is their breathing rate getting fast? Are they finding it difficult to breathe? Are their lips and fingertips turning blue? Are their mental status, is it normal, or is it changing to one of confusion and being unresponsive? Secondly, you should also monitor their general health, which includes making sure that they have adequate fluid and calorie intake. Also, one important thing we would want to underscore is that please make sure that you consult with your metabolic team to have a plan and to determine if a sick day diet would be needed to avoid elevated ammonia levels that can come with an acute infection like this. Now, thirdly, you have to monitor signs for elevated ammonia, and I think Dr. Grootman will take this as well as some of the other acute neurological presentations of COVID-19. Dr. Grootman?
Sure. So some of the more common features associated with high ammonia levels, particularly as those ammonia levels get into the brain, are alterations in behavior. This can be agitation or combativeness, alteration in mental status, so patients can be confused and then can actually become lethargic or sleepy, may go all the way to coma. An impaired balance, coordination, or gait, or walking. So somebody who looks like they're unsteady, unstable, they may fall, or they may look, quote unquote, drunk. In addition, as medical teams have been researching COVID virus and the presentation of individuals, we now know that there are several neurologic presentations that can occur both acutely and also after the recovery from the COVID-19. So this can include brain infections or meningitis or encephalitis, central hypoventilation, which is a breathing problem that's caused not by a difficulty with the lungs, but because the brain is not working. The brain respiratory centers are depressed, and therefore the patient can't take deep breaths. Stroke has been reported as well. Now, once the infection is well established and or recovering, patients have been reported to have secondary complications such as an acute disseminating encephalomyelitis, which usually follows an acute infection. It can also cause confusion and motor problems with coordination. This can affect the thinking part of the brain or the brainstem, which has the crucial functions of breathing and heart rate. There can be spinal cord manifestations with paralysis, and that's called a transverse myelitis. We've also seen a few cases of the Guillain-Barré syndrome, where patients will experience weakness predominantly in an ascending pattern, starting with the lower extremities. They may lose their reflexes, and they may also develop problems with heart and blood pressure. And longer term, some patients may develop a sensory neuropathy, so loss of sensation, typically starting in the feet, but may work itself up the leg, may have a glove stocking distribution. In other words, just like that sounds, if you're wearing a stocking from the knee down, there may be altered sensation, but from the knee up, things may feel normal again. There can also be, which is not on this list, myositis or inflammation in the muscles. So it's really important and sometimes difficult to distinguish whether this is a typical Guillain-Barré from another virus or it could be due to COVID-19.
The key here is to be prepared and work with your metabolic team to have a plan in place in advance. Thank you, Dr. Grotman.
Sure.
Our next question, do we need to change any of our regular plans for going to the emergency room when a child shows symptoms about an elevated ammonia level?
Sure.
Dr. Grotman, do you want to take this one?
Sure. The answer to this question would obviously be different for each individual. It really depends upon the metabolic status of the individual, their medical history, and the structure and expertise available at the local medical facilities. So we strongly recommend that you contact your metabolic team and have a plan in place for evaluation and management of a potential hyperammonemic crisis. Emergency department visits may be quite challenging during the pandemic, and an alternative plan should be in place to limit wait time and the potential exposure to COVID-19 in the ER. The CDC now recommends calling your doctor first before visiting an urgent care or emergency room. Contact your metabolic doctor, as there may be an alternative entrance or access to the ER staff in order to avoid exposure to others who may have COVID-19. Wear a mask, avoid touching surfaces or your face, and use hand sanitizer frequently. If the person is having trouble breathing or is becoming unresponsive, call 911.
Thank you, Dr. Grotman. I think we had one slide, and then our next question. I'm going to ask Dr. Nagamani to answer this. If someone with UCD comes down with what they believe is COVID-19, should they be admitted to the hospital right away to have their ammonia levels monitored?
So we strongly recommend that you contact your metabolic team and have a plan in place for evaluation and management of potential hyperammonemic crises. Admission to the hospital would typically be required only if there's a primary reason, such as respiratory difficulty associated with COVID-19, or there are any symptoms suggestive of elevated ammonia. We don't think that every patient with UCD and COVID-19 will need to be hospitalized right away.
Thank you, Dr. Nagamani. Our next question, we have an upcoming appointment for routine UCD blood work scheduled for the beginning of May. Should we reschedule this due to the risk of catching COVID-19? Dr. Grotman, would you like to take this question?
Sure. So a lot may change between now and then and will depend upon where you live in the country and what the disease density of COVID-19 is in your region. You should certainly discuss with your metabolic doctor if the blood draw is necessary now for routine care or whether it's reasonable to delay it.
Thank you. Our next question, since people with UCD shouldn't have steroids, would they be able to have a puffer prescribed by the hospital if they got COVID-19? Dr. Nagamani?
Sure, I can take this. So while it's generally true that systemic steroids, what I mean is either steroids given in the form of pills or by IV injections. These are best avoided in individuals with UCDs. They may be needed for emergencies. Now, neither Dr. Gropman nor I are specialists in either infective diseases or in intensive care of individuals with COVID-19. But to the best of our knowledge, the current guidelines for treatment of COVID-19 do not routinely recommend use of oral or IV steroids. Now, steroids may be recommended in specific circumstances by physicians for treatment of people with COVID-19. And in such circumstances, they should be made aware of the risk of ammonia elevations with the use of steroids and make sure there's a plan in place in order to monitor for that. Now, if inhaled steroids, these are required. These are steroids that you breathe into your airways. The dosing should be best administered whenever possible by what is called a metered dose inhaler rather than a nebulizer, because in the nebulizer, there's the risk of aerosolization of COVID-19 viral particles and releasing them into the air. Thus, it can increase the risk of infection for others around the individual.
Thank you. Can you also take the next question? How does a poor respiratory system or the effects of COVID-19 on the respiratory system affect metabolism in UCD?
So again, I think we've discussed a few parts of this in the previous slides. If during the course of COVID-19, if there were to be respiratory compromise and the individual can develop severe respiratory illness, that could be a stress to increase the risk for hyperammonemia. So this has to be monitored in anyone with severe respiratory illness and UCDs.
Thank you. The next question, my son has not been out of the house for a month because I'm petrified. Can he go out for walks with a face mask? Dr. Gropman?
Sure. In light of the new data about how COVID-19 spreads, along with evidence of widespread COVID-19 illness in communities across the country, the CDC recommends that people wear a cloth face covering or a mask to cover their nose and mouth in the community setting. This is an additional public health measure people should take to reduce the spread of COVID-19, and in addition to social distancing, frequent hand cleaning, and other everyday preventative actions.
Thank you, Dr. Gropman. Our next question, is there a risk for a Ravicti shortage? I know several parents who are getting up to 3 months supply in advance. Do you have any concerns about availability of medications, low protein foods, formulas, supplements, and whether supply chains are affected? I'll go ahead and take this one. The manufacturers of Ravicti, Horizon Pharma, have assured us that there's no shortage and they don't anticipate any issues with access or distribution. We've also been in touch with the major formula companies, low protein food manufacturers, and they have also assured us that there should not be any access or distribution problems. If you think you're going to have a problem or you just want to have a plan put together, please contact us at NUCDX and we'd be happy to assist you. Our next question, we've been told not to use Tylenol in people with UCD, and we use ibuprofen instead. However, some COVID-19 reports caution against using ibuprofen if someone gets the virus. So what is the recommendation for UCD patients if they get the virus? Dr. Gropman?
Thank you. So there are minimal data informing the risks of non-steroidal anti-inflammatory drugs in the setting of COVID-19. Concern about possible negative effects of non-steroidals like ibuprofen have been raised by anecdotal reports of a few young patients who received NSAIDs early in the course of infection and experienced severe disease. However, there have been no clinical nor population-based data that directly address the risk of NSAIDs. Given the absence of data, most regulatory bodies have not made specific recommendations that NSAIDs should be avoided when clinically indicated.
Thank you. I'd like to direct the next question to Dr. Nagamani. We've read in the news about some people with COVID-19 receiving an anti-malarial drug, hydroxychloroquine, as an experimental treatment. Are there any precautions about using this drug in people with UCD if they get the virus?
So before addressing that, I just want to say what the hydroxychloroquine and chloroquine are. These are oral prescription medications that have been used for treatment of malaria and certain inflammatory conditions. Now, both hydroxychloroquine and chloroquine are under investigation in clinical trials for either pre-exposure or post-exposure prevention of COVID-19, and also for treatment of patients who've already had the infections. There are currently ongoing clinical trials, and at least in 2 clinical trials, there were recently halted because there were significant side effects associated with the medications. Now, what the FDA recommends and what the experts recommend is that the use of these could be done under clinical trial settings. But if the patients were not to be in centers that would provide them access via the clinical trial, then the FDA has developed an emergency use authorization to use the chloroquine and hydroxychloroquine from the strategic national stockpile for treatment of hospitalized adults and adolescents with the COVID-19 in whom the trial cannot be done. But in those patients, I think the following precautions have to be taken. The healthcare providers should carefully review the warnings and drug interactions before prescribing the hydroxychloroquine sulfate. We should also exercise caution in patients with UCDs and known liver disease, as the medication can sort of concentrate in the liver. Hydroxychloroquine may also increase the risk of convulsions in patients with a history of seizures, and patients with UCDs can have seizures, so this is something to keep in mind. These medications can also have behavioral related adverse events such as psychosis, delirium, agitation, confusion, and so on. And these may mimic the symptoms that are seen with elevated blood ammonia in individuals with UCDs. The activity of certain anti-seizure medications might be impaired if they are administered along with hydroxychloroquine, so the physicians need to be aware of that. And hydroxychloroquine should not be used in patients who have retinal or visual field defects, in patients who have heart issues, who have abnormal EKGs, and they should not be used in patients who already have known allergies to the medication. So I think these are particularly the precautions we have to take in patients with UCDs.
Thank you so much. The next question, if a vaccine for COVID-19 ends up using a form of the live virus, will it be a problem for UCD patients and UCD liver transplant patients? Dr. Nagamani, would you like to take this question?
Sure. Currently, there are multiple approaches being investigated to develop vaccines for COVID-19, including mRNA-based techniques, protein-based techniques. It would be premature to comment about any future viral vaccine and the safety of that vaccine in those who have undergone liver transplant. But once the time comes, the regulatory body should sort of have some guidance regarding what the safety of this should be in the general population, as well as in the population who are immunocompromised.
Thank you. Our next 2 questions I'll ask Dr. Nagamani to take. How long after schools and daycares reopen should we wait to reintroduce our UCD children? Should extra precautions be taken? Any comments about the predicted resurgence of COVID-19 in the fall?
Well, again, as you would realize, there are a lot of unknowns right now. And as you would also be aware, the recommendations by the regulatory bodies as well as the governmental institutions are changing based on the data that they are getting. So I think right now it would be hard to predict whether there would be a resurgence in the fall, and I would recommend that you please refer to the most up-to-date guidelines from the CDC, the WHO, as well as your local health authorities regarding what needs to be done in the future.
Thank you. And finally, this went to Dr. Grootman. What precautions can we take that the CDC has not mentioned, and how will life change in general after this?
Well, certainly life will be changing in ways that we can't even imagine. So I think that patients and caregivers need to keep monitoring the CDC website. This is an evolving situation, and certainly we will revisit this. If there are future changes or recommendations, we will update the UCDC community in a future webcast.
Thank you. So I think this is going to wrap up our questions for today. We had so many questions. We tried to consolidate some of them, and we'll try to answer some of them in future webcasts. On behalf of all of us in the UCD community, thank you, Dr. Grootman and Dr. Nagamani, for sharing your time and your expertise with our UCD patients and families. We'll keep everyone up to date. And if someone has a question in the meantime, please contact NUCDF, and we'll try to answer your questions. We'll show a resource page, and we'll keep some updated resources for you on the NUCDF webpage. You can also visit the CDC webpage and the World Health Organization, the WHO website, which has extensive resources. Thank you. Take care. Be safe.